Welcome to a new episode of the Startup Perspective. I think one of the silver lining of the pandemic was that healthcare became a priority for each and every nation. Innovation, led by the zeal of the startup ecosystem, really flourished. India now has 100 unicorns, but what is well less known is that one out of every five startup in India is either in the healthcare or the wellness space. Today, we're delighted to have Pankaj from W Health Ventures. He's based out of the United States and invests in healthcare both in the US and India. And he's going to share his experience and insights with us. To begin, let's talk about how you've seen the healthcare ecosystem evolving both in the United States and in India. And why do you think today it's such an exciting place to invest into?
In India, the digital health ecosystem is fairly nascent but rapidly evolving. Certain enabling factors exist that have helped expedite India's digital health ecosystem. First, the just general internet penetration and digital adoption. Indian consumers are now consuming content online, are making purchasing decisions online. Second, India is a market where consumers continue to pay for healthcare needs out of pocket, especially their outpatient healthcare needs. And this inherent consumerism means that the Indian consumer is now, or the Indian patient is now, making buying decisions, even in healthcare, based on experience, quality, and cost. And finally, it's the pandemic. The pandemic has exposed the vulnerability of India's healthcare ecosystem for all of us to see. That means that founders are building companies based on personal experiences and needs. It also means that patients are now more willing to adopt newer models of care. And typically, the healthcare industry is fairly slow and cautious towards change. But the pandemic has just accelerated that by several years, both for patients as well as for doctors. And as a result, in 2021, venture capitalists invested over $2 billion in about 150 digital health companies in India. We're also starting to see more M&A activity. We're seeing the emergence of healthcare unicorns, four since the start of the pandemic. And we believe that the decade for digital health is just about getting started. And there's going to be a lot more adoption, a lot more real success in the coming decade.
Thanks, Pankaj. And one of the things I think the epidemic exposed is how fragile our healthcare systems, both in the US and India, were. As you look forward, what are some of the learnings from your portfolio companies you would like to share with us?
Look, the reality is that in India, we're seeing a few core challenges as we think about healthcare. First is that of access. We just don't have the skilled resources or infrastructure that we need to deliver healthcare at scale to everyone. And the second is that of affordability. A majority of Indians pay for most of their outpatient needs and some of their inpatient needs out of pocket because of lower insurance penetration. And what we've witnessed is that to solve for these two core challenges around access and affordability, technology is the only way, right? And what we've witnessed through our portfolio companies that have scaled in this space is that technology-led models have a real shot of solving for these problems. I think the first trend that we're seeing is that of consumerization of health. We're seeing newer care models beyond the traditional telemedicine, e-pharmacy, and diagnostic models seem to emerge. Care is moving more closer to home, away from the hospitals and the clinics, to address the friction points that patients face. Companies such as Beto in diabetes, or Milo in women's health, or the Good Health Company are creating differentiated service and products for the Indian consumer, wherein they're keeping patient outcomes, but also patient experience front and center of what they're building. And these startups are growing, even outside of the metros. They're growing in thousands of cities and towns at very, very rapid scale. And as these startups grow, we continue to be zeroed in as a fund on metrics like clinical outcomes, like patient retention, but more importantly, just on metrics like customer acquisition costs, as well as unit economics. Second, we are seeing the emergence of a completely new workforce in healthcare, and that of health coaches. Um, Health coaches work hand in hand with doctors in as part of these new companies. Health coaches are enabled by technology. They're the first port of call for patients and are really driving patient experience, patient engagement, patient retention. For example, say in a diabetes model, a health coach will be responsible, could potentially be a nutritionist and would be responsible for driving nutrition change, driving other behavior change for patients in order to keep patients motivated, help them ease into new behaviors, and drive long-term loyalty from patients as well as great clinical results. I think the third interesting trend we're seeing is digital health companies in India building for the rest of the world. Just like the IT services companies from a couple decades ago or Indian SaaS companies in the last decade, we're seeing the emergence of Indian digital health startups building for the rest of the world. These startups are typically have a differentiated technology. They typically hire small local teams in the markets that they're present. For example, Visa is a company in our portfolio where they're on a mission to scaling access to high quality mental health globally. Uh, Visa has about 4 million individuals on the platform in over 65 countries throughout the world. So, similar to Visa, we're now seeing a small but growing number of digital health companies from India building for the US and building for the UK and building for the rest of the world.
So they say if you can do it in Indian healthcare, you can do it anywhere globally, at least in the emerging markets. So, what do you think are the white spaces in healthcare you're looking for? And what's your investment thesis which you think will have maximum impact?
Absolutely. So there are several opportunities as we think about digital health in India. Maybe I'll talk through two of them today. The first is health insurance. It's a sector that we continue to be excited about, and the reason for that is a majority of India still remains uninsured or underinsured when it comes to health insurance. Only 37% Indians have some form of health insurance, and a lot of this health insurance is limited for hospitalization or inpatient, and patients continue to pay for their outpatient needs out of pocket. We're seeing lots of entrepreneurial activity when it comes to health insurance, especially focused on groups or on employers. And there continue to remain, two spaces within health insurance that we're interested in investing in. The first is just companies that are building more comprehensive insurance offerings that cover both outpatient and inpatient needs for patients. And the second are companies that are solving for the distribution issue of health insurance and trying newer models for distribution, especially focused on the retail Indian consumer. And second, the opportunity is, the concept is broader. We're seeing newer advances in care delivery and healthcare technology all the time, throughout the world. And and despite all the entrepreneurial activity in India, we still see large gaps that exist in several subspecialties. You name the subspecialty: oncology, pain management, cardiology, and the list goes on. So I think the question that we ask ourselves is that a lot of this global innovation that's happening, throughout the world, can that be contextualized for the Indian setting and launched in India? And our evolving perspective is that as a fund, in addition to investing in companies that have found product market fit, we'd also like to build some of these companies from the ground up, obviously in partnership with the right founders, with the right mission-oriented founders. And to do so, we're building internal capabilities around product, around research, around commercialization that several of these companies can leverage. And with this venture studio or venture factory, we hope to build, meaningful solutions for the Indian consumers that address several of these pain points that still exist.
Thanks, Pankaj. I think it's a great time to be in healthcare. The large players are reinventing themselves as platform players. And we can all see that the value creation will be the interplay between the traditional players and the startups in the ecosystem, which will make healthcare accessible and affordable for all of us.